There are 41 active cases. There are 3 new cases. 2 of those cases are in hotel quarantine and 1 new locally acquired case. A total of 4,032,336 test results have been received, which is an increase of 37,509 since yesterday. Regarding the 1 new locally acquired case that is in the numbers today, just earlier the Department of Health and Human Services has listed the MCG as a potential acquisition site. This follows a patron attending the MCG testing positive. This person attended day 2 of the cricket on the 27th of December and is currently isolating. It's important to note from the health advice that they do not believe that the case was infectious whilst he was at the MCG. He developed symptoms on the 30th of December and the department was notified of the positive test result on the 5th of January. Contact tracing that has gone on throughout the night has revealed he stayed home since the 31st of December and got tested. And as they have previously done so, the public health team, through the tracing work, are verifying this information. The department is also investigating a possible New South Wales link to this case, but out of an abundance of caution and to provide this information to the Victorian community, we are declaring both the MCG and Chadstone Shopping Centre as an acquisition site to rule out any potential source on that day. Therefore, we're encouraging anyone who was at the cricket and who was seated in the Great Southern Stand, Zone 5 of the MCG between 12:30pm and 3:30pm on the 27th of December to go and get tested and to isolate until they receive a result. A COVID safe plan was in place at the MCG for this cricket event, and an excellent ticketing allocation system was put in place by the MCG, and as a result this has enabled this effective contact tracing and has been able to see anyone who was seated within that Zone 5 bubble will be receiving a text message in the next couple of hours advising them of the situation and requesting that they do go and get tested. I'll also ask Jerome in a moment to talk to the other potential acquisition sites, particularly around Chadstone Shopping Centre. I'd like to thank the 37,000 Victorians who got tested yesterday, and also again reiterate our great thanks to the health staff, the health workers, the additional lab staff, logistics team who have worked through this period, many of whom have returned from a planned holiday to come back to help us with this increased testing effort to keep our communities safe. And testing really is a whole of community effort, and they're doing a great job. And 37,000 tests is a really strong result for this time of year. Just on a couple of other matters before I ask Alan and then Jerome to add to my comments. Yesterday we asked the public health team to review Victoria's return to work schedule in Melbourne CBD, given the current outbreak here in Victoria. What was planned was for the Victorian Public Service to begin a phased return to work of up to 25% of the workforce from next Monday, and commercial offices were set to increase their staff on site from 25% to 50% from next Monday. All of this was, of course, based on the public health advice and the circumstances of the time. The public health advice back into government has been to pause these changes for 1 further week, and they will provide further advice and information next week on what may be able to take place the week after. This is so we can continue to monitor very closely the situation in both New South Wales and also respond to the known Black Rock cluster here in Victoria. We're obviously keen to see no further cases emerge beyond those previously identified through the primary close contacts. Also further to this, we're asking all public transport users to register their MyKey cards. We have seen a small number of public transport services have been added to the list of exposure sites, and another way to add to our contact tracing efforts and to give us another source of information is to be able to contact people who have a registered MyKey card. So we're encouraging Victorians who use public transport, who use a MyKey card, to go and register that card, create an account, register the card, and this can be done quickly and easily through either the Public Transport Victoria website or call centre. We do have, as at 3 o'clock yesterday afternoon, a total of 7 services that have been identified as a possible exposure site across our network, and we are wanting people who think they've travelled on these services to contact the department. Just finally, I'd again really like to thank our contact tracing team who have worked throughout the night to provide us overnight and into this morning with this information that we're providing right now. Within less than 24 hours of first being notified of this new positive case, we've been able to talk to the case, contact many close contacts and identify these potential acquisition sites, and then start the process of both advising the public and contacting those other patrons at the MCG. Garnering this wealth of information from our contact tracing team has helped us to act very, very quickly to respond to this new case. And it also does serve as a reminder to us all that even with the milder symptoms, we're continuing to encourage Victorians to go and get tested. Jerome will talk to the additional testing, the resources that have been put in place yesterday and today, as we all work very hard to keep Victoria safe and to keep Victoria open.